it's Dr. G. I hope you guys are doing good. Short little video here just to clarify something, just because I've had two people ask me that now. And the question is, so now that you're a physician, after being a nurse practitioner, what side are you on? And I've actually gotten this question from nurse practitioners and even got this question from a resident. What side are you on? And this is the response that I give to that question. Fortunately for me, guys, I don't get to choose what side to be on. Having been a nurse practitioner for several years and now a physician, I can comfortably be on both sides. And by being on both sides, that means when I see things that are not right, when it comes to nurse practitioner practice, education, anything having to do with nurse practitioners, I can comfortably speak on it with no issues at all. Same goes for physicians as well. I tell people a lot, I enjoyed being a nurse practitioner. There were also a lot of things in nurse practitioner education and practice wise that didn't quite resonate very well with me, but that also goes for being a physician. I can't tell you that everything about medicine, everything about being a physician is something that it's amazing, something that I love, because there are also things about medicine, the U.S. healthcare system as a whole, that I have issues with. But as time goes forward, those are certain things that we will talk about. Let's just say that is a topic for another day. But just to put this out there, guys, I am fortunate enough that I don't get to pick sides, because I've been a nurse practitioner, also a physician, and I get to speak on both sides. Now, it's more like if I see nurse practitioners struggling and there are things that I can do to help them out, by all means, I will do that. Same goes for physicians. There's so many things that needs to be changed when it comes to being a nurse practitioner. So guys, I don't get to pick sides. I am on both sides of this fence right here, and I will comfortably speak on both sides. That being said, the other thing someone else had mentioned to me was, because I had put out a video talking about the number one problem with nurse practitioner education. I believe that's what sort of prompted some of the other questions, like from nurse practitioner, about what sides are you on. I believe that one person posed this question to me saying, hey, what do you even stand to gain from this? I mean, you're a physician now. Why go out of your way to talk about the problems having to do with nurse practitioner? Because that's not your headache anymore, you know? But I get it. And that's part of advocacy. You know, when we talk about advocacy in healthcare, that's what it is. And I totally agree. Speaking on the problems associated with nurse practitioner education, me personally, right now, I'm not working as a nurse practitioner at the moment because I'm working as a resident physician. But at the same time, when I see these things happening, it behooves us, all of us. Okay, we're tasked with that responsibility of speaking up, letting our voices be heard, you know, making a difference. So again, that's what advocacy is all about, you know. We don't do it. It's more like when you advocate for your patients, the things that you do for your patient just for their own well-being and things like that. We're not doing that to better ourselves or for our own self-gratification. Nurse practitioner organizations have reached out to me, you know, to interview me, to talk to me more about this whole issue and what I think about it. That's all it's about. If I can use my voice to affect change, if I can use my voice to get people that are responsible for making these changes to sort of spin things into action, then I feel like I have done my job at that point. But like this person that sent me this message said, what do you stand to gain, you know, by going to fight for nurse practitioner education, fighting for things to change and all that? And another part that I think about is, guys, think of it. And for those that have kids, think of it. Who knows? One of your kids might be the one that chooses to be a nurse practitioner tomorrow and all. Like, wouldn't you even be happier knowing that things have been modified from the way they are right now, provide them like better clinical education when they actually get to that point? But that's all I'm saying. We do these things not to benefit ourselves, but to impact that change that will definitely benefit someone else out there. That's what healthcare is all about. But anyway, I just want to take a few minutes just to speak on this. So yes, I am not on any sides here. I do not take sides. And when I make these videos and recount these problems, things that are associated with, you know, nurse practitioner education or the programs, even the practice itself, I don't do it to downplay the education of nurse practitioners. I don't do it to badmouth nurse practitioner as a whole, but I do it to get the word out. I do it to let those that are responsible for accrediting these programs, to get them to start listening, talking to themselves and saying, What can we do differently? What can we do to change this? Because when we start to compare nurse practitioner education and practice to your physician assistant counterparts, you start to see there is a big difference there. There's a lot that can still be changed. There is room for improvement, guys, and that's all this is about. And guys, just before I end this clip, I just want to make an important point here. For those that feel like there is some sort of competition between doctors, nurse practitioners, PAs, and other healthcare providers out there, I'm sorry that you feel that way, because it should not be that way. There is a role for physicians. There is a role for nurse practitioners in the healthcare society. There is also a role that PAs play in the healthcare system as well. And as long as everybody respects that, as long as you respect your scope of practice and do what you're trained to do, I don't see why this should be an issue. Honestly, I don't see why it should be an issue. A lot of people talk about the scope encroachment and things like that, which I totally understand that. Honestly, I do, because there are people that forget that as a nurse practitioner or a PA, there is that gap in your knowledge. And you got to be able to recognize that what that physician does, the way that physician was trained is different from the way that you were trained. As long as we're able to understand that and respect that, in simple terms, you stay in your lane. That's the easiest way I can put it. You stay in your lane. You do what you're trained to do. It's like me, a family physician, trying to be a cardiologist. Oh no, that is out of my scope. You stay in your lane, guys. And if we can all do that, like I said, there is a role that everyone plays in this healthcare system. Look at these statistics in rural areas about the number of healthcare providers that they have seen patients. Sometimes you have over 1,000 patients to one healthcare provider, to one physician seeing that person. And the issue of healthcare diversity, the accessibility continues to be a problem in America. We know it. It's a fact. Not even just America, around the world. But let's understand that singular fact that everyone's got a role to play. You have a role to play as a nurse practitioner. You have a role to play as a physician. You have a role to play as a physician assistant. And as long as you stay within your scope of practice, I think it should not be any issues at all. That's my personal take on that. People argue a lot about these things online. I read these Reddit comments and stuff like that. But like I said, I'll be the first one to tell you when there is that gap in my knowledge. I know what I know and what I don't know. And I tell people, medical school wasn't so easy just because I was a nurse practitioner. No, because I also had to put in the extra work to get to where I'm at. So make no mistake and think that because you're a nurse practitioner, you can easily do what a physician does. And also a physician, make no mistake thinking that a nurse practitioner has no role in this healthcare system, because I completely do not agree with that, guys. I don't. So I just need to put that out there. That's how I feel about this whole thing. But anyway, I'm going to go ahead and end this right here. It's Dr. G. Guys, if you have any questions, comments, email, feel free by all means, and I'll definitely respond to you, okay? Until next time, don't forget to subscribe, like, comment, share. As usual, you guys take care. Bye.